And today's Math in the News, we have Dr. Singh-Uppal in with us from the California Cardiovascular Institute. And I know that we usually have one of you doctors in with us for the past couple of years around Valentine's Day, because we used to do things, and I was like, you know what? Everybody associates the heart with Valentine's Day, so I wanted to start bringing you guys in. And you guys have kind enough to come in for the last few years. So welcome today.
Thank you, Mike, for having me.
And what is your role at
California Cardiovascular Institute? I am a heart rhythm specialist. They call it a cardiac electrophysiologist, a fancy way of saying I'm an electrician of the heart.
Okay. And there's a lot of stuff that goes on with the heart and a lot of things that you're looking at and specific things based on what somebody is going in for.
Absolutely.
And one of the first things, so I can say, this is beautiful right here. This is
a pig heart, it's not a human heart. So
right.
Just showing you the chambers of the heart,
right.
how heart is a muscle, is a pump. It's keeping us alive. The job of the heart is just to pump the blood so that all the nutrients and the oxygen can be supplied to all the organs and tissues. So it's the engine, just like a car's engine. It's pumping blood at a certain speed.
This is the main component.
This is the main component.
You need this. This isn't working right. It doesn't matter what else.
It stops, you stop.
You stop, right. So one of the things that happens is when people go in to you or any other doctor, one of the first things they do is usually take their blood pressure.
Correct.
And I know that I went in, and this is kind of how we were, because I needed to get my regular checkup and stuff. So we went in, and I had my blood pressure taken also. So we've got a little video of this right now. We can see up on the monitor me having my blood pressure taken. I'm not taking my blood pressure.
Yeah, it's a three, we call it the vital signs. The reason we call it the vital signs, blood pressure, your pulse rate, your oxygen, and your respiratory rate. Those are the four things which keeps us alive. So the first component is to check the blood pressure.
And there's a lot of things that you're looking at on that monitor when they showed that. One of the things that people often say is, well, your blood pressure is a little too high or it's too low. So there are certain parameters that you want in there. And I know that a lot of times, and for people with eagle eyes caught the numbers that were on the screen when I was in there,
right.
There's a thing called the white coat syndrome.
That's a real thing. I see a lot of white coat. Just coming to a cardiologist's office, let alone a regular doctor, everybody's blood pressure will go up. Now, guaranteed, you're just walking in an office and you're just putting you down and checking your blood pressure. So in an ideal world, you should be sitting down comfortably for a good 10-15 minutes. And sitting in an arm's level, you check the blood pressure. That's the real way to check a blood pressure with a cough.
Okay, and I know that when I went a couple of minutes later into another room to have another test done, they took it again, and it was down about 14 points. So it's like, oh, that actually
But white coat is
right
you get anxious looking at a doctor, what's the news they're going to tell me. So you have your kidneys release a hormone called adrenaline. That adrenaline is going to make your heart race faster and increase your blood pressure.
All right, well, I know you've got a nice presentation here, so let's continue to go through this.
So you check your blood pressure, you check your oxygen levels, and then when they come to me, I'm an electrician, so this is how the heart's electrical representation on a piece of paper, called an electrocardiogram.
Okay.
Here, what we're looking at, what is your heart rhythm, at what rate. So there's a lot of mathematics. We're doing do the math. So the heart is a pump, is beating at a certain rate. So actually, we look at what rate the heart is beating. So this is an electrocardiogram called an EKG, and you're looking at these little spikes here. The spikes are telling you what is the top chamber, what is the bottom chamber, at what rate, how they look like.
Okay.
Through an EKG, we can determine if somebody's having a heart attack, any heart rhythm issues, is the heart running slow or heart running fast.
So as we're looking at this, what is this heart doing right here?
Correct. So I'm going to show you the math about it. So when we look at an EKG, we do simple maths. So 60,000 divided by the heart rate will give us numbers in called milliseconds, or the vice versa. So I'm going to go back to that slide. Each of these small squares is a 40 millisecond. Each of these little bigger squares is 200 milliseconds. That's 1/5 of a second.
Okay.
So if you calculate number of spikes, starting here, there's one spike. If you go back, 1, 2, 3, 4, that's 4 squares. 4 multiplied by 200 is 800 milliseconds. If you add a little bit, so this is 840 milliseconds between these two big spikes.
Gotcha.
If you 60,000 divided by 840 is 75 beats a minute. So this heart is beating at 75 beats a minute.
And what is the optimal? Is there an optimal?
So less than 60 beats a minute, we call it bradycardia. The heart is slow. Above 100 beats is tachycardia. So that's fast. So the average human heart should beat between 60 and 100.
Okay.
On an average, it's 70 beats a minute when we are standing right now.
Gotcha.
Again, then we look at the heart rate. We look at a lot of things on the EKG. This is the window to the heart. So we look at a lot of things. When they come to me, I'm looking at arrhythmias and a lot of other signs. This is just an animation showing you a beating human heart. The heartbeat starts right up in the top chamber called the sinus node. It's like a battery. like a car's battery. It will generate that impulses, which will travel through the heart muscle, go down a tiny wire. So me and you are born with a wire called an AV node, atrioventricular node.
Okay.
That node will conduct the electricity to the bottom chamber. So it's like a timing. The top beat needs to beat first. There's a time delay, and the bottom follows. So normal human heart, the top beats first, the bottom follows.
And there are times when that is off.
That's off. So example, in this example, showing you an atrial fibrillation. So something causes the top chamber to go in a very fast, irregular beats. That is the most common arrhythmias we deal on a daily basis. So the top goes fast, the bottom starts going fast. So that's another common reason for tachycardia, rhythm. So that animation shows you the fibrillating human heart. Everything is chaotic, running, racing. And then this is an EKG, same thing, remember I said EKG. So this EKG is showing you, before, if you look at the old one, it was a nice one beat, and here everything is becoming chaotic.
Over, right.
This is what an atrial fibrillation EKG looks like.
Okay.
So this we can diagnose through an EKG, through an Apple Watch, through different cardio monitors and things like that.
And right now I know that we had an EKG done on me, and then this is what they were looking at right there when I was all hooked up,
Right.
doing my electric.
Exactly. So you start with the blood pressure, and now they're trying to figure out what is your heart doing from outside, right? That's what's the heart's electricity is doing on an EKG. What I'm showing you here actually is a real human heart, and in a Langendorf perfused thing. So this is obviously from a cardiac transplant patient getting a new heart.
Okay.
So they take an old heart and they can connect it to this. So what you saw is that actually heart is fibrillating in AFib. And when you may have heard about, we can restore somebody's rhythm back to normal. We're doing cardioversion. We put paddles on the chest and we deliver electric shock. That's what you're showing here is the heart is fibrillating. This is the top chamber, this is the bottom chamber, and we can restore the rhythm back to normal.
Because that's what a lot of people will see. Like a lot of kids even will go, oh, you know what, I've seen people do that with these paddles or whatever, and that's what's going on.
Yes, because your heart is an abnormal rhythm. That paddle will deliver a very high electric shock. It stuns the heart for a fraction of a second so that the heart can start back in a normal rhythm. Again, there's a lot of mathematics which goes inside a human heart. We just don't see it. But a heart has its own, the heart is a beautiful organ where the physics, the chemistry of the ions brings out this beautiful biological organ. So there's a lot of channels. The heart rate is controlled by different channels in the heart. We call ion channels. That's what controls your sinus node, your AV node. So there are a lot of different clocks. You know, we're talking about mathematics here. So the heart has an oscillator, a simple oscillator, a harmonic oscillator, different oscillations. So that's what's controlled your heartbeats, 60 beats a minute, 70 beats a minute.
Okay.
So, and what I'm showing you here is an actual human heart in a real patient. We actually can go inside the heart, try to measure all the electricity and display on a 3D map. So what you're seeing here is it's a sinus node normal propagation, how the electricity travels in a heart if somebody's interested to see. You see the beats start in the top chamber and then it just goes down. This is what I do day in out in a lot of our patients who have various arrhythmias or the fast heart rhythms.
And talking about the electric still, because one of the other things I had to do was after my EKG, they also started keeping track of that as I was on a treadmill. And what exactly, I mean, because you're trying to get the heart rate up to a certain number,
Right.
correct?
With the treadmill,
And here's what they're looking at right now.
With the treadmill, we're trying to figure out how fast your heart can go, number one. Number two, what's your blood pressure response to exercise? Number three, with the treadmill, we're trying to see if there is any evidence of blockages or the decreased blood supply to your heart, the electrocardiogram on a treadmill will become abnormal. We call STT changes. And number four, we're looking at your cardiorespiratory fitness. So a treadmill test is a beautiful test, stressing your heart's engine, your body, your car's engine, to figure out if the engine's going to break or are the chances to break.
And I passed mine.
Congratulations.
I mean, because I'm here, right? I mean,
You're here.
I passed mine, right? I mean, I did pretty well.
Yes.
Because I know that they said, all right, we need to get you up to a certain point, and we got there. But then they said, we need to stop you when you get to a certain point, even if I wanted to continue on.
Yes.
We did a little bit, but you don't want to go further than that because there is another mathematical equation to figure out those numbers, what your low is and your high, and not to go past that.
Absolutely. So the magic number is 220 minus the age of the patient. That's your top heart you want to achieve on a treadmill test.
So as an older man, that number gets...
That usually goes down.
Right, I was going to say, but if I can keep it up, then
you're in good shape.
Good.
Yeah.
All right, let's continue on.
So again, as I said, the heart is an engine, is pumping blood, has a battery called a sinus node, has a couple of wires. So those wires needs to be also stay in a good shape to conduct the electricity. So, and heart has many, many different branches. And then the speed of the electricity which travels in our human heart can be up to 3 to 4 meters per second. That's a lot of speed. You know, the electricity has to go from top to bottom at certain speed.
Okay.
If something causes the speed to go down, medications, aging, heart attacks, your heart can slow down, and those patients may require pacemakers or other therapies. So just like cables, their heart has cables too. And this is how a human heart looks like. If you dissect the heart looking in a microscope, these are all the different cables which requires the whole heart to beat in a synchronous fashion.
About 5-second response. How often do you dissect the heart to learn?
When you go in your med school,
Earlier, right.
earlier in the things, but as a teaching, we usually dissect a pig heart or a sheep heart to show it the other students if they really want to know what goes inside
Okay.
the human heart.
But I'm just curious as to how often
not very
students
often,
would
yes.
be doing that. Okay.
So again, showing you an electrocardiogram, this is the most abnormal rhythm a patient can have. This is called ventricular tachycardia. The heart is going at a speed of, if you look at remember those numbers I told you, so this is almost around 200 beats a minute. Normal is 60 to 100, so this is bad news.
Yeah,
So-
because somebody's either exercising a lot or there's got something going on.
Correct. This could be a sign of an old heart attack. There's a scar tissue inside the heart, and the electricity can become abnormal. So my goal is to go inside the heart, find where this is coming from, and I'm going to get rid of it.
Okay.
So in this example, what I'm showing you, this in a human heart, this little tiny thing is called a catheter. We take a piece of a cable which can deliver electrical energy to burn a piece of tissue. So in this patient, I went inside the heart, find the spot where the fast rhythm was coming from, and ablated it and cured the rhythm.
Okay. So you're just zapping it.
You're zapping
and
it.
being
So,
done with it.
yeah, in this patient, it came coming out from close to where the aortic valve, the main valve is. It's a piece of muscle. You go and burn the piece of muscle, and you can cure a patient from these
Okay.
deadly rhythms. And the last one, I think this is another EKG electrocardiogram. Again, remember, everything starts with an electrocardiogram for an electrician. So this is what we call an atrial flutter. This patient is in a fast rhythm. The top chambers are beating at 300 beats a minute. So what I'm going to show you next is, this is actually a pig heart. Electricity rotates around and around in this top chamber. And then we can go in the heart and find, this is a 3D map, and you can all tell the electricity is going in a counterclockwise direction. So that's
You
what
can see that.
You can see that. So this is the cool thing we do. We make 3D maps. A lot of mathematics goes behind creating these maps. There's somebody who's mapping these things.
Right. And a lot of people might be like, I don't need to operate on something like that, but I can apply my skills to aid in this kind of
Exactly. So
medicine.
the people who do the mapping for us go to biomedical programs, biomedical engineering. So a lot of engineering things are happening behind this.
And one of the last things I know that I had to do was they did an ultrasound of mine also, and then we have some footage of that. And what you're looking at on the screen as they're looking at mine, and we can see how mine is going. And that looks pretty good, doesn't it, doctor? Right?
It does from far away, it does very good, yes. Yes. But with an ultrasound, you're looking at the heart's strength, how strong the heart is pumping. You're looking at the valves, make sure they're not leaky, and then looking at the sizing of the heart. They're not getting bigger or smaller.
Okay. So I know that we're just about out of time. We certainly do appreciate you coming in and talking to us around Valentine's Day more about the heart. And I know that a lot of times people go, somebody broke my heart. So a heart can't actually be broken into pieces, but it can break by not functioning properly. And that's what you guys help take care of.
That's pretty help. And there's a term for that. It's called a Takotsubo heart or a broken heart syndrome. When somebody gets really a bad emotional news or stress, the heart function suddenly goes down. The heart stops pumping blood immediately, or the function gets weaker. We call heart failure. In those cases, you just support the heart with medications, a lot of reassurance, and it'll get back to normal.
Right. So there is that.
There is.
Just like the white coat syndrome,
Yes,
same thing.
there is
like
a broken heart
broken
syndrome.
heart, and there it is. All right. Dr. Singh-Uppal, thank you for coming in.
Thank you, Mike, for having
we
me.
Certainly do appreciate you guys every year coming around. We'll be back with more right after this.